This presentation is on the article Analysis of Polio Eradication in Africa. My name is Monica Bassoni. My major is Health Sciences. The current learning objectives for my major include understanding the healthcare system, health policies, and the different roles surrounding the health science field. This article was written by a team of writers. The authors include Alan S. Craig, Rustam Hyderov, Helena O'Malley, Michael Galloway, Halima Dow, Nagashi Nyong'o, Marie-Therese Banyikva, Savita Nekvi, Nima S. Abid, Carol Pondock, and Amy Edwards. Discovery process of the article. When discovering the article used for this assignment, the main search engine utilized was Google Scholar. The main topic of interest for the presentation was eradicating modern diseases. Therefore, the key term searched was eradication of modern diseases in foreign countries. Why this article? This article was chosen for 3 reasons. The topic was very interesting and significant to the discipline of global health. The topic itself expands on themes discussed in this course, including what experts are doing to eradicate diseases, specifically polio, and how this contributes to improving health worldwide. The main points of the article. The article addresses the devastating impact of polio and its impact on the African population. It also highlights the research groups working to eradicate polio, such as the World Health Organization, United Nations Children's Fund, and the Ministry of Health. The article also addresses the steps taken to eradicate polio in Africa. The purpose of the study. The article introduces GPEI, or the Global Eradication Initiative, which is a private group that is dedicated to eradicating polio in foreign countries, including Africa. The GPEI has strived to eradicate polio by enacting the 4 pillars of disease eradication. Pillar 1 is surveillance, which is very important when treating and eradicating polio. It helps locate people who are suffering from polio and allows these individuals to be treated. The second pillar is routine immunization, which consists of vaccinating individuals in Africa. The third pillar is administering supplemental immunizations, such as booster shots, to individuals who have already been vaccinated to isolate breakouts. The fourth and final pillar is campaigning, which allows the GPEI to raise money and awareness towards the polio eradication campaign. This article also addresses the main challenges of eradicating polio, including lack of funding for vaccines, travel, and education resources. Study participants. The study participants include community members in Africa who had contracted the polio virus. Studies were focused on people from the following regions: Chad, the Republic of Congo, Democratic Republic of Congo, and Nigeria. Methods used to collect information and data. Investigations, data, and reports were conducted by the Ministry of Health, World Health Organization staff members, and village polio volunteers. Village polio volunteers are team members who live within the village and report any cases of polio outbreaks. In 2016, VPVs were stationed in Somalia. They reported that 75% of polio cases occurred in non-accessible areas, while 43% took place in accessible areas. These cases were reported and investigated within a 48-hour period. After analyzing the collected data, MOH determined that Africa had significantly high rates of polio. The country of Chad is a large contributor to the spread of the polio virus. The Ministry of Health reported that the country of Chad alone contributes to about 70% of unimmunized children who have contracted polio. In addition, Nigeria is also responsible for 60% of polio transmissions in Africa. In response to this crisis, the MOH has partnered with the United Nations to set up a registry program to track vaccinated and unvaccinated children in Chad. In just a small period, the vaccination rates between the ages of 0 and 23 months jumped from 17,000 to 94,000 in only a few months, leading to reduced polio outbreaks. Due to the success in Chad, the Ministry of Health and UNICEF are working on moving this registry program to other countries in Africa, including the Republic of Congo, the Democratic Republic of Congo, Nigeria, and Guinea. The polio spread has been monitored by the Global Polio Laboratory Network, or GPLN. The GPLN is responsible for testing sewage and stool samples to ensure that the polio virus has not traveled to uninfected regions of Africa. The GPLN has access to 145 specialized and accredited laboratories where samples are tested. If samples come back positive for polio, it is reported that medical responders will travel to the area to treat the outbreaks. Core values. The core values of the GPEI include bringing healthcare to insecure, hard-to-reach areas. By doing so, this will help the GPEI achieve its ultimate goal, which is to make the world polio-free. The GPEI has strived to increase equity and social justice by making polio vaccines more accessible and affordable. The GPEI is striving to move its medical efforts to areas with low funding and minimal access to vaccines and healthcare, and is currently focused on areas such as Nigeria and the Central African Republic. They have brought groups of healthcare professionals to these low-income areas. These professionals will educate the people in these regions about what polio is, its effects on the population, and how to address the virus. It will also give the population access to vaccines. These medical professionals will also stress the importance of basic interventions, such as hand washing to remove germs and prevent illness. To achieve their goals of making the world polio-free, the GPEI implemented multi-tiered networks, which are designed to reach and treat areas with high outbreaks of polio. These networks are used to organize door-to-door visits to improve access to immunizations for the elderly or those who do not have access to transportation. Door-to-door visits are conducted by social mobilizers who consist of teams of highly trained medical professionals, administering vaccines and educating the people on preventing disease and the importance of vaccines. Social mobilizers also build relationships with political and religious leaders in an attempt to normalize vaccinations. As of 2014, there were 1,078 social mobilizers in Sudan, 14,000 in Nigeria, 14,467 in Cameroon, and 3,616 in Somalia. Currently, the Democratic Republic of Congo is working with the Ministry of Health to initiate a new policy. The National Community Health Policy will allow for social mobilizers to begin working in the Democratic Republic of Congo. Core concepts and how they relate to global health. In 2015, it was reported that Africa accounts for 10% of the world's population and contains 25% of global disease. However, it only contains 3% of healthcare workers. From an epidemiological standpoint, Africa is very high risk and likely to transmit diseases to other regions. In an attempt to maintain this, the United States Center for Disease Control and Prevention has been actively working to prevent outbreaks from occurring and traveling. As previously noted, outbreaks are prevented through surveillance and regular testing of the water systems and other outdoor spaces in the environment. For traces of the polio virus and wellness screenings, verifying that the human population doesn't have any recent outbreaks. To prevent continuous outbreaks, the people in Africa have been offered booster vaccines to continue to promote immunity. Functions of public health. In 2012, to address any issues that arise with the polio prevention plan, the GPEI has implemented emergency operations centers. These centers were opened in 3 different countries: Afghanistan in 2016, Nigeria in 2012, and Pakistan in 2014. The emergency operations centers were specifically created to address unique emergencies related to healthcare. The Emergency Operations Center is equipped with state-of-the-art technology used to process and analyze data and communicate with healthcare teams. A large role of the Emergency Operations Center is managing resources and ensuring all organizations are properly funded. Funding alone is one of the largest challenges the GPEI faces with the polio eradication plan. The EOC works with the government and funding agencies such as UNICEF, WHO, and MOH. Funding for the eradication of polio has been steadily declining since 2016. Addressing the polio outbreaks in Africa alone can start as low as $1.4 million per year. and range to over 100 million or more per year. UNICEF, WHO, and MOH are partnering with organizations from different countries to raise funding to treat the outbreaks in Africa. The World Health Organization, Ministry of Health, and UNICEF have gone from country to country, campaigning and raising awareness towards the polio outbreaks occurring in Africa. In 2014, these organizations were able to receive donations from Germany and Canada, with Germany donating 13 million and Canada donating around 250 million to support the polio eradication plan. However, since then, donations have been declining and the resources necessary to treat polio on a global scale are becoming limited. Public health domain environmental factors. Polio has a large impact on the environment. Polio is an acute viral disease that can cause severe damage to the digestive and nervous system, or paralysis in severe cases. Polio is contagious, and it can be spread through person-to-person contact. It has been shown poor personal hygiene and sanitary practices can lead to increased spread of polio. In some regions, when sewers or water systems become contaminated, this leads to a mass spread of the disease throughout communities. Public health domain socioeconomic factors. Socioeconomic factors contribute to the spread of polio. 40 to 80% of the African population alone experiences poverty. In Nigeria specifically, 67% of the population is below the poverty line. Illiteracy rates and low education levels are a contributing factor to the spread of polio because awareness towards germ prevention and basic hygiene and sanitary practices are limited. In addition, these areas often lack the financial resources needed to support medical clinics and services necessary to treat these outbreaks. Oftentimes, tribes or communities in Africa associate their healing system with their religious system, and they believe that diseases are obtained from evil spirits and try to treat these diseases with native medicine and healing practices instead of modern medicine. Public health domain biological factors. Biological factors have a large impact on the transmission of polio. For example, polio can affect all age groups, but is most common in children 5 years and younger. This is because children are less likely to be vaccinated compared to adults. Polio can have detrimental effects on children and adults, causing long-term paralysis, muscle weakness, and damage to several internal bodily systems. In summary, the article introduced GPEI and analyzed the long-term goal of making Africa a polio-free continent. To achieve these goals, GPEI has created a plan following the 4 pillars. These pillars include Pillar 1, which is surveillance used to locate unvaccinated individuals and monitor outbreaks in African regions. The second pillar is administering vaccines. The third pillar is administering booster vaccines. And the fourth pillar is using campaigning to raise money. To support these goals, GPEI has recruited community mobilizers and village polio volunteers to help screen for and treat those who have contracted polio. These efforts have been successful in reducing polio outbreaks. However, financially, the GPEI is struggling to support these efforts. The GPEI works with UNICEF, MOH, and WHO to raise financial resources to support this vaccination plan. However, financial resources have been declining drastically. Future goals for the GPEI include strengthening and building new partnerships with the help of WHO, UNICEF, and the MOH in order to raise money and continue to support the polio eradication plan. What was learned? The main concepts that were learned from this article were Africa and its impact on spreading diseases globally. Africa consists of 10% of the world's population and contains 25% of global diseases. In addition, the countries in Africa are the largest contributors to polio and its global spread. The country Chad contains 70% of unvaccinated children, and Nigeria has contributed 60% of polio transmissions. Based on this statistic, if the polio outbreaks in Africa are not addressed, They can spread quickly to another continent, infecting and harming other nations. This is the reference page, and that concludes the presentation.